Dr. Seetha Ramaiah. I am a diabetologist in Venkatramana Nursing Home, Ongole. Since 20 years, I am practicing in diabetology. So today, I'm update on in hypertension. My talk is on latest update in hypertension. As per WHO, 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. So in India, the prevalence has also gone up to 30 years to 38 years, 38% in men and 32% in women, from 29% and 28% respectively. So International Society of Hypertension has released 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempts to address the issue that in resource poor settings, optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The AHA and ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk, among low risk adults with stage 1 hypertension. So acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate if we severe COVID-19. A recent study which appears in the Journal of the American College of Cardiology reports that metoprolol can reduce lung inflammation and improves the respiratory function in people with COVID-19 induced ARDS. So lowering systolic pressure targets down to the 110 to less than 130 range substantially reduced CV adverse events in the STEP randomized trial, affirming the SPRIT finding for an older Chinese population among some 5,800 patients aged 60 to 80 in China, with intensive target trimmed 26% of the composition CV risk. What regard the prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommended that the diagnosis of hypertension should not only be dependent on the office BP measurement, but also on out-of-office measurements, such as ambulatory blood pressure monitoring, or home blood pressure monitoring. So most patients with hypertension requires lifelong medical therapy to achieve optimal BP control. So 2018 European Guidelines equally recommended 5 classes of antihypertensive drugs, considering high non-adherence treatment. That the importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European Guidelines recommended, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination, ACE or ARBs and plus CCB or diuretic. So conclusion that usually the combination of the drugs, either AC inhibitor or ARBs, diuretics or ARBs with CCB, is always better to achieve the good control of blood pressure by systolic 110 and diastolic 80. Thank you, Ananda.